I'm a pediatric neurologist at County USC Medical Center. And
I'm Jessica Lowe. I'm a dietitian at County USC.
And we are here to talk about dietary therapy for epilepsy. Where we're very grateful to Brad Levy and others for inviting us. We want to make sure that as a epilepsy community, you get exposure to all the different therapeutic options to try to treat your seizures or the seizures of a loved one. So as many of you know, about a third of individuals with epilepsy worldwide continue to have seizures despite multiple medication attempts. And when you fall into that category, and there's probably even more individuals who do not tolerate, thank you so much, who do not tolerate many of our medications because of various side effects. So there's a real role beyond medications and pharmacological interventions to help improve seizures and quality of life. So there are many options that will be discussed. Brain surgery, which is the main option that can actually be curative and potentially lead to medications being weaned off. And there's neurostimulation devices. So there are more and more options. But dietary therapy is something that's been with us for probably hundreds and hundreds of years, because essentially prior to the early 19th century, we had zero medications besides opium and sedatives that helped control seizures. And looking in various scriptures and other non-religious texts, there's references to faith healers and medical experts at the time recommending fasting as a mode of helping reduce seizures. So fasting is something that's been with us for a long time, and it was finally studied formally in the 1920s, where they took a handful of children and adults with both convulsive and non-convulsive seizures, and we knew their baseline seizure frequency and severity. And they said, well, let's do some fasting for up to 2 weeks and see what happens. And there was dramatic reduction, if not full control, of seizures in those individuals. But of course, that's neither sustainable, and it's pretty inhumane to fast a child or an adult. So there was a physician in New York who said, well, what happens? Asked a really simple but important question of what happens biochemically in your body when you fast. What is it about fasting that might reduce uncontrolled electrical activity in your brain? And he recognized what happens, which we knew for a long time, is that you stop essentially, you deplete your glucose and your sugar sources from your carbohydrates, and at some point your liver stops producing more glucose from breakdown of proteins and other sources, and you start to break down fats. And when you break down fats, you release ketones. And there's something about this energy currency that when it crosses the blood-brain barrier, it, in a method that we don't completely understand, absolutely proven in animal models, helps reduce seizures. So this physician in the 1920s essentially designed a very high-fat, low-carbohydrate diet, which is essentially became the diet that was used for decades. It's called the 4-to-1 ketogenic diet ratio. The ratio means basically for every 4 grams of fat, there's 1 gram of combined protein and carbohydrates. And fats have more calories than carbohydrates and protein. So it ends up being like 90% of your calories is from fat. And he did a study using that diet and showed similar effectiveness as fasting, but of course you can sustain this diet much longer. And it was remarkable that by just changing what you put into your body, you could have such dramatic control of your seizures. He also noted in many of those children, not only did the seizures improve, but the parents noted, and the children who could speak noted that they could be more clear, cognitively, intellectually, they were higher functioning, and their mood improved. And this is a really key component of dietary therapy that we still stress, and a lot of our individuals on the diet tell us that this is one of their favorite aspects. Some of our medications, many of them can be sedating, but typically the diet does not have that side effect. But importantly, that physician in the 1920s also recognized that some of the kids were feeling sick, and they had lack of energy, they could vomit, but if they just got a glass of orange juice or apple juice, they felt better. So clearly, one of the side effects of this very restricted diet that was used, that is still sometimes used today, is that your sugar can drop to a level that can make you feel sick. And that, because of that recognition and sometimes the difficulty of calculating your meals, there are more liberal forms of these diets that have evolved. And I'll let Jessica, our dietitian, talk to you about the various forms that we use today in clinical practice to help individuals with epilepsy.
Thank you. So there are 4 really well-studied types of diets for epilepsy. The first is a classic ketogenic diet, which is it's probably the most strict form. I use it for young children, children who feed through tubes, and some other circumstances as well. It's classically very high in long-chain triglycerides, so everything you might think of, from butters to mayonnaise, oils, and it's the most strict as far as carbohydrates, so just maybe a few grams, depending on what some kids need. I do my best to make it taste good, but it's shown to really work in a lot of kids. The next one is the modified Atkins diet, or sometimes we're calling it the modified ketogenic diet. It's a more liberal version. It was created in about 2003 by Johns Hopkins. It's kind of an extreme form of the Atkins diet for weight loss. It's for children, we typically recommend anywhere from 10 to 15 grams of carbohydrates, and adults 20 to 30 grams. Based on our needs and my practice, I might fudge that around a bit. And I give goals. We don't weigh or measure foods like the classic ketogenic diet. You just count carbohydrates and make sure you stay within the recommended limit. The next one, I forgot the medium chain triglyceride diet. Medium chain triglycerides are found in 2 types of oils, coconut oil and palm kernel oil. It does lots of things, but per calorie it makes more ketones than do those long chain fatty acids. So in theory, you can have more carbohydrates than in a classic ketogenic diet. That one was created in about the 70s. The last one is a low glycemic index treatment. I'm not sure if many of you have heard about the low glycemic, or the glycemic index. It's used for diabetes in controlling blood sugar levels. And so the thought behind that one is if we can better control blood sugar levels, which we do find in the classic ketogenic diet, we too might be able to help improve seizure control. With this diet, we do restrict carbohydrates as well, but you can have more around 40 to 60 grams a day. So it's a lot more liberal. We just like to make sure that the carbohydrates you do choose are within those parameters. They're low glycemic. Again, all of these are high in fat, and we do see mostly ketones can be made. There are a few things, goals for me whenever I put someone on this diet. One is definitely to optimize seizure control. The second is to maintain good nutritional status. We have found that a lot of, at least in my experience, many of our children and adults tend to lose some weight on this. Some necessarily, some not so much. But so I monitor that closely. And my other third goal is to make sure you guys feel comfortable doing this, because it's a total lifestyle change. It's not like, I'd like to say it's as easy as taking a medication, 3 times a day. You eat 3 times a day, but it's definitely not the same, because you go out to eat with friends, you have holidays, you have birthday parties, and I like to make you guys feel as successful and comfortable enough to go out in the world and have it not impact your life so much. I want you guys to feel pretty empowered by doing this. It has, like Dr. Partikian has said, it does really change lives, and we've seen it do amazing things as far as seizure control, but also how people feel. And so I really like the diet for those reasons.
So with the diet, one of the aspects of the diet that I really appreciate and recognize as a physician observer is, and Jessica alluded to it, is you as the individual, you as the main caretaker, you as the person who prepares the meals, and you as the patient the individual who consumes the meals, you are really in charge. Absolutely, we always recommend, as do all medical centers, that there's a experienced nutritionist involved and a medical team. But at the end of the day, you really have a lot of flexibility to prepare meals, with a nutritionist recommendation to fit your lifestyle too. While it is a significant change in some aspects of your lifestyle, in other ways it opens these doors that are, I didn't really imagine when I first learned about the diet in a very formulaic fashion in a hospital setting. And one of the reasons we're starting to notice that, hey, this diet is a lot more flexible and there's this real empowerment aspect to it is because of this woman standing there. So Lori Eissman from the Carly Eissman Foundation, they're a wonderful, wonderful advocacy group that really stresses various aspects of dietary therapy. And I'm going to give Lori a chance to speak at the end. But essentially, what she showed us from a parent's and family's point of view is that while Jessica and I are up here talking about the diet and it sounds very formulaic and grams and numbers and maintaining nutrition and hydration, at the end of the day, this is very doable for many, many of our families. And there's a lot of independence and uniqueness that you can infuse into that preparation of the meals, and it's a really social encounter and really important part of just interacting with others. So we have a monthly course that Lori and Jessica will tell you about, a kitchen cooking class, and it's wonderful, and everybody's invited to join us. Before we get to that, I do want to tell you, so anytime a physician talks to you about a new option for helping your seizure control, we need to put it into perspective. So across several studies looking at over 1,000 individuals of various ages who've gone on different forms of these high-fat, low-carbohydrate diets, we've seen that about half of individuals have a significant reduction in their seizures, 50% or more, and about 10% of individuals have a 90% or greater reduction in their seizures. So that's the great news. And we're talking about an incredibly drug-resistant population of people who have very drug-resistant, severe forms of epilepsy. So that's very impressive statistics. I can't stress that enough to you. And the people who do not benefit from the diet, many of them drop out of our recommendations or this lifestyle change because it just doesn't work for their family potentially. And I suspect many of them just don't have the appropriate support network. And this is one of the reasons why I think Lori and Carl as parents wanted to create this kitchen, to really show people firsthand, you can do this and we're there to help you. And there are many, many parents and adults who are there, who are going through this on a daily basis, and they've adopted this because they know it's healthier for them. But another, probably half of the half, so about 25% of people probably drop out because of some side effects. Jessica alluded to some concerns about weight loss. Sometimes people do have lack of energy on the diet, and we try to supplement them to make sure their sugars aren't too low. We try to give other supplements like carnitine, which is a vitamin that helps you really metabolize those fats more efficiently. We try to make sure you don't have too much acid in your blood, because that could make you feel tired. That can make you have strange breathing, and it's not good for your bone health long term. We supplement you with vitamins and other things. So it is a commitment, because typically every 3 months, at least for the first year, we get a pretty comprehensive list of blood tests and urine tests. And this is recommended by the International Panel on the Ketogenic Diet. So these aren't things that we've just made up. Every center tries to follow these guidelines to make sure that first we do no harm. When you're on the diet long term, we also worry about kidney stones, but there's some evidence that if we just give you the right supplements, make sure you're not too acidotic and you have plenty of hydration, we can dramatically reduce those risks. And by the way, we have medicines that make you have kidney stones too. Topamax, Zonegran are two major culprits. And then there's a concern about, well, what about the long-term cardiovascular health on your cholesterol in your blood vessels when you consume a lot of fats? And I'm sure all of you guys know the entire American Dietetics Association is kind of shifting away from fat is bad, fat is bad. You know, 70% of your brain is fat. And as a baby growing up, a significant proportion of breast milk is natural sources of fat. So yes, you need a healthy balance of fat in your diet, but when we're coping with, you know, a horrible disorder like epilepsy, and it's posing major threats on a daily basis to your happiness or the quality of life of a loved one, there are some risks we might take under supervision. And many of the families that start to notice improvement, studies have shown within 3 weeks you can see significant improvement in your seizure control, especially if you have frequent seizures. The diet helps any form of epilepsy. So whereas surgery is for seizures that are coming from one region of the brain, and we need to identify that region, make sure we're not going to injure you by removing that region, epilepsy has been shown, these high-fat diets, including the modified Atkins, have been shown to improve seizures that start on both sides of the brain, generalized at the onset, seizures that start in one area of the brain, multifocal seizures, or just mixed epilepsy. So I think that's really important. There are some medications and neurostimulation devices that are broad spectrum like that, but the diet definitely can help any form of epilepsy. And now we have evidence that across the age spectrum that the dietary therapy can be incredibly helpful. And at more and more medical centers, we have now adults asking us to help them. So Jessica and I go to our adult epilepsy clinic at County USC a couple times a month to help our adult patients go on these diets. And of course, again, the kitchen is open to anybody. And then even if your seizures are genetic, even if you have a structural malformation, dietary therapy can still help. So there's very, very few reasons why we don't consider dietary therapy. I'll talk about some of the medical reasons and let Jessica talk about some of the nutritional reasons. So medically, before we expose you to lots of fat and completely dramatically change your metabolism, we want to make sure you can break down fats and you can transport fats to the right place. So we do the screening tests that take about a month and a half to come back to make sure you don't harbor one of these incredibly rare disorders, incredibly rare. We want to make sure you're not already severely acidotic, you don't already have a history of multiple kidney stones or some sort of serious underlying heart disease. The other thing that we want to make sure is you're not somebody where if we can get you to surgery, we can cure your epilepsy today. Because we do want to cure your epilepsy, that's always the goal. So those are the major medical reasons why we might say we don't think you're an ideal or safe candidate for the diet. But I would say that all that put together maybe applies to maybe 10% of individuals I see, if that, probably a lot less. So I'll let Jessica talk about some of the nutritional concerns she has.
Again, one of my major concerns for starting the diet is if someone's already quite underweight, just because there's a risk for more weight loss. That's one. For some children with severe neurological disorders, sometimes they don't haven't identified some feeding issues. And with fat, it slows lots of things down in the body, so you can cause some reflux. One of the other side effects is constipation. And so we can get some silent aspiration going on, just some very dangerous things where we can get pneumonia, choking on some things, and I just want to make sure we intervene at the right thing at the right time. So if they have some feeding issues, I want to identify that first prior to moving on to another very specific therapy. Sometimes some children have severe constipation. Significant, this diet can cause severe constipation, so that's one reason why we might not start the diet. I think those are the main nutritional reasons.
I want to give Lori a chance to speak. You know, as a parent who went through this firsthand and still on a daily basis has really energized a whole group of physicians like myself, dietitians like Jessica, and other families to really break down some of the boundaries and some of the mythology about these diets. Lori?
I don't need a speaker. I'm a 30-year
I think they're
teacher.
recording, so
do I
just
need
for
to
the sake of
speak into it?
recording. Yeah.
My students always tell me I'm loud enough. Hi, I'm Lori Eissman. We started the Carly Eissman Foundation possibly 2.5 years ago with the one purpose of helping other families. We had our daughter probably at the age of 12, the day she started her period, within 1.5 years on probably 14 different medicines. Nothing worked. She was an athlete and she was so medicated, she lost her hair. I tend not to focus on the negative because what we decided, and I know if any mom and dad, anyone out here can relate with us, we would have gone to the moon to find something for Carly. We were actually on our way to China and we found a wonderful doctor that works with Dr. Collagen with Arthur, and she told us one day as I was pulling the things off Carly's hair on New Year's Eve that there was this thing that we should try because we were foodies. We were kind of into food. Well, my husband and I, at that time, there was nothing on the internet except one website on the Modified Atkins diet from a man in Colorado. And I'd still love to give him a hug someday if I ever meet him. And read his 2-page website that take the carbs out and see what happens. Well, we did that. Long story short, Carly was seizure-free, 100%. We were the percentage that it completely took her seizures away. We didn't, as we were going through all of this, to be honest, we did not go to epilepsy groups. We were just proactive in making her Carly, not Carly with seizures. She wanted to do what she wanted to live. She wanted to be a teenager. She wanted to be all that. We found that food worked. Well, unfortunately, we lost Carly, and she's in heaven. So through all of that, my husband and I decided we can't sit back. We have to keep talking for Carly. And we decided, where do you go at a party? Where do we all go? We end up in a kitchen, right? It's the one place we can all relate. You, I don't know you, but I guarantee if I sat down and had dinner with you, we would know each other. So we went to USC, and these two are the most amazing humans that I've ever met as people and as doctors and dietitians because they're open to learning and listening. They both come to every single class that we have in our wellness center. They participate. They're open to it. The biggest thing I want to do, and my husband, is educate the next world of doctors and neurologists, because the number one email that I get every day, 10 times a day, is I told my neurologist about dietary therapy, and they told me, I've heard of it. It used to upset me, but it doesn't anymore, because I understand they just don't know about it. So what we're doing in a community in Los Angeles is we're going into a community, bringing the families to us. We have 9 families that have come every time we're almost 1 year old at the Wellness Center right in the middle of the Keck School of Medicine. And we have classes that are free. And what we're doing, me with my big mouth, because I love to speak, but my husband's a chef. And all my daughter's best friends, we come and we cook. And we make amazing food. We make cauliflower pizza. We make chips made out of Parmesan. We go and we feed the families that want to try this. It's not easy for a lot of people to give up French fries and pizza and soda. We live in a world that fast food's on every corner. But my first thing I ever say to a parent is, why not? You've got lots of doctors telling you, giving you lots of doctors, options, but this is something you can control as a family. And it's better for you. And you feel better. And you're healthier. Our first family that we have now that has come every time, mom lost a lot of weight. Dad lost weight. The daughter is seizure-free. She's lost a lot of weight. She's playing soccer full-time again, something that she never did a year ago. She didn't want her quinceañera, is that how you say it? She wouldn't even go to that, didn't want to even have it because she knew there would be sugar there. And now it's like a whole new... The thing I can't explain to you, the passion in our kitchen, you have to come. If you live close enough to us, we're in Los Angeles, we hope to be all over the United States. But the great thing about our foundation is I met a family, that's why I was late, that live in Utah. And you're cutting me off, and do I have to stop?
No, you're going to be at your booth all day.
Okay, I've got a booth. I've got all kinds of paperwork. But just, if you've never heard about it, come talk to us about it. If you have heard about it, get our card, get on our website. If you don't live in California, it's okay, because we can talk to wonderful dietitians that can connect you with other dietitians. This is something you can own. I watched my daughter go from being completely medicated to having a wonderful 4 years of being seizure-free. And that's why we're here. And it's for all of you. So come to our booth and have some coffee.